Hello, good evening. My name is Dr. Michael. I am a GP here at University of Nicosia Medical Center. I'm a general practitioner and I have an interest in infection and sexual health. I originally trained as a doctor in London, where I did a BSc in immunology, and my selected components were virology. I've subsequently done diplomas in gynecology and also in dermatology, and also done courses on genital dermatology. So this really is an interest of mine, and I'm going to try and get through some important messages about sexual health, but also sort of things around sex, consent, the law, etc. So let's move on to the presentation then. Right, so things we're going to be discussing today are a whole host of different topics. Discussing topics around sex, it's really important to pick what applies to you. So a couple where they were sort of high school sweethearts and got married and are still married and they haven't had any other partners, going to have quite different sort of information which applies to them versus someone who has sort of multiple partners and has a sort of different lifestyle. So please don't be offended. Please just take whatever applies to you and apply it to your own life. And if you have any questions, of course, you can sort of discuss with your doctor or with me if you are local and you have any queries that you need to discuss. So we're going to discuss a little bit about World AIDS Day and the statistics around HIV, as well as some emerging knowledge on HIV and stigma. We're going to start sort of before people even have sex, what the law is, what consent is, abuse of power, etc. We're going to discuss what we can catch from sex in terms of infections and sort of what to do about that. We're going to discuss how infections are passed on, how to stop that, and how to prevent them in different ways. When to test, what to test, how to test, what isn't testing, which is really important, as well as how you can get access to doctors and testing locally. Right, World AIDS Day is every year. It's on the 1st of December. And it's to raise awareness really around HIV and AIDS. Now, in most of the world, people tend to still refer to AIDS versus HIV, but they're two very different things, as you may know. HIV is the virus. AIDS is what happens when you aren't controlling the virus with medication and it damages your immune system. So people who have HIV and are on medication, actually even before they start medication, can be living quite happy, healthy lives without sort of any problems. But as the virus progresses and it damages the immune system, they are less able to fight common infections, which most of us will be able to fight off quite easily, and it affects them in much more severe ways than it would someone who doesn't have HIV. So we're shifting away from using the term AIDS and more towards using the term HIV. So as we've mentioned, World AIDS Day brings awareness around the topic. As of 2020, there was 40 million people living with HIV globally, and there was about 1.5 million new cases. And unfortunately, up to 1 million deaths. Women are more likely to be affected than men are. Unfortunately, only 64% of people with HIV are currently on effective treatment. That means that about 36, unfortunately, will die due to no treatment. That is the majority. The majority of those individuals are in places like Africa or countries where they do not have the funds to treat people with HIV effectively, and that's something that we need to change. And there are being sort of steps made in that direction as well. So a little bit about HIV. It used to be that HIV was a very big diagnosis to receive. It still is a very big diagnosis to receive, but luckily today there are very, very effective treatments. Since the 1990s, I think around 1996, there was something called highly active retroviral therapy. That is a term that you don't need to remember, but essentially it's a combination of 3 different medications for HIV, and they are so effective at controlling HIV that you can actually bring down the level of the virus in your blood if you have HIV to an undetectable level. That means that the level is so low that they can barely pick it up with tests. Of course, with more modern tests, we can detect it, but they call it undetectable if it's below a certain threshold. The other important thing to remember is that receiving a diagnosis of HIV is no longer a death sentence. It hasn't been for a long time now. They say that people with HIV can live pretty much a normal lifespan. There is, according to new data coming out now, approximately a 2-year reduction, but that's less than a condition like diabetes, which can lead to up to a 10-year reduction in your lifespan. So we're not trying to pick between diseases. You should try not to have either, but it's not as bad as what people used to think it was, and definitely not as bad as what it once was. So the new trend in educating around HIV is this concept of undetectable equals untransmissible. So what does this mean? Let's go into this briefly. As we've learned with the coronavirus, people who've got a lot of virus, who are shedding a lot of virus, have a high viral load, and that means that they're highly infectious as well. So it stands to reason that the lower your viral load, the less infective you are. If you are receiving treatment for HIV and your viral load is undetectable, that means that your levels of virus in the blood or the semen or the vaginal fluids is very, very, very low to undetectable. The thought is that it's very difficult to impossible for you to pass on the virus. Of course, nothing is 100%, and that doesn't mean that you shouldn't still use protection like condoms, which will protect and prevent passing on the HIV to others, but it's considered a much less risk than what it once was. This is also known as treatment as prevention. So what used to happen is with patients who had HIV, because the medication also was quite toxic to the body, they tended to wait until the HIV had done enough damage to the immune system before they started therapy. Now, with much more modern drugs, with less side effects, they tend to treat a lot earlier on in the process to bring down the viral load and prevent people being able to spread it further. Condoms, as we said, should still be used, but it's important to identify that, it's not so difficult to pass on HIV. You can't catch HIV from a handshake, from hugging people, from being in the same room as people, from kissing people. It's a lot more difficult to pass HIV than it is any disease like the coronavirus, for example, which is a lot easier to pass on. So we shouldn't be afraid of having friends or lovers or having relationships with people with HIV. If you have any doubt, you can always discuss it with the person's HIV consultant and ask the questions, because understandably, if it's your first time coming into contact or dating someone, for example, with HIV, you might have a lot of questions, and it's completely fine to have those questions. Just feel free that you can ask those questions to a medical professional who'll be able to advise you accordingly. If you want more information on the concept of undetectable versus untransmissible, and you're watching this video on the recording, just pause your screen now and copy this address. There's more information here about how they came to this conclusion, and it's based on the results of multiple studies which have been conducted on the topic. So before we even get to sex, there's certain considerations that we need to think about. We are in Cyprus, so it's important to know the law. The age of consent for sex in Cyprus is 17 years old. And this means that if you have sex with someone who's under 17, that's technically illegal, even if both persons are under the age of 17, say they are both 16. So if someone has sex with someone who's under 13 years old, then it's statutory rape, and that can lead to a max sentence of life imprisonment. Between ages 13 to 16, it can be considered rape, and it will lead up to 3 years in prison. More recently, with the trends in particularly younger people taking photos and videos of themselves having sex, or even just naked photos, it's important to remember that sharing those pictures, particularly without consent, also known as revenge porn, that can lead up to 16 years imprisonment. And that was a law which was passed recently. Also, if those pictures are of a person who's under 18, who's still classified as a child, that is technically child pornography, even if the person themselves has taken it. So if the person's, say, 15, they take a picture of themselves naked or a picture of themselves having sex with someone, that is technically child pornography and it's illegal. So that's something that you need to bear in mind. This, of course, is my personal understanding of the law. If you wanted a more clearer clarification, you would get advice from a lawyer. On the topic of consent, so for people to be able to give consent to sex or even not to sex, to anything, kissing, foreplay, whatever, it's important that the person can understand, retain the information, weigh the information, and have the correct information, and also communicate that decision. So if anything is affecting that, say, for example, they can't talk for whatever reason, say their perception is altered because they are drunk, they have taken drugs or whatever, they won't be able to give valid consent. The other thing which can affect that is coercion. So consent has to be uncoerced. So you shouldn't have someone pushing someone or placing pressure on someone to have sex. That means that they won't give consent freely. It will be given under duress or under coercion, and that won't be valid consent. They will quite rightly say, I only agreed to something because I was pushed into it, essentially. And it's important to remember the power imbalance with that. And we're going to talk a little bit about that later. The other thing to consider is having the correct information. So if someone is lying about something, then the other person can quite rightly say, I took my decision to have sex with that person based on the information I was given. If that information was false, particularly deliberately false, they can say, I wouldn't have consented otherwise. Say, for example, someone had active syphilis. They knew that they had active syphilis. They lied to someone and they said that they didn't have syphilis when in fact they did. That person then agrees to have sex with them, say without a condom. That would be consent which someone might argue wasn't given with the correct information. So you just need to be very, very careful on that. So now we're going to show you a video on consent. This is a sort of famous/infamous video which has been making the rounds on YouTube. So I'm just going to stop the presentation here and start that video.
If you're still struggling with consent, just imagine instead of initiating sex, you're making them a cup of tea. You say, hey, would you like a cup of tea? And they go, oh my God, I would love a cup of tea, thank you. Then you know they want a cup of tea. If you say, hey, would you like a cup of tea? And they're like, I'm not really sure. Then you can make them a cup of tea, or not, but be aware that they might not drink it. And if they don't drink it, then, and this is the important bit, don't make them drink it. Just because you made it doesn't mean you're entitled to watch them drink it. And if they say, no thank you, then don't make them tea. At all. Just don't make them tea. Don't make them drink tea, don't get annoyed at them for not wanting tea. They just don't want tea, okay? They might say, yes please, that's kind of you. And then when the tea arrives, they actually don't want the tea at all. Sure, that's kind of annoying as you've gone to all the effort of making the tea, but they remain under no obligation to drink the tea. They did want tea, now they don't. Some people change their mind in the time it takes to boil the kettle, brew the tea, and add the milk. And it's okay for people to change their mind, and you are still not entitled to watch them drink it. And if they are unconscious, don't make them tea. Unconscious people don't want tea, and they can't answer the question, do you want tea? Because they're unconscious. Okay, maybe they were conscious when you asked them if they wanted tea, and they said yes, but in the time it took you to boil the kettle or brew the tea and add the milk, they are now unconscious. You should just put the tea down, make sure the unconscious person is safe, and this is the important part again, don't make them drink the tea. They said yes then, sure, but unconscious people don't want tea. If someone said yes to tea, started drinking it, and then passed out before they'd finished it, don't keep on pouring it down their throat. Take the tea away. Make sure they are safe, because unconscious people don't want tea. Trust me on this. If someone said yes to tea around your house last Saturday, that doesn't mean they want you to make them tea all the time. They don't want you to come around to their place unexpectedly and make them tea and force them to drink it, going, "But you wanted tea last week," or to wake up to find you pouring tea down their throat going, "But you wanted tea last night." If you can understand how completely ludicrous it is to force people to have tea when they don't want tea, and you are able to understand when people don't want tea, then how hard is it to understand when it comes to sex? Whether it's tea or sex, consent is everything. And on that note, I'm going to make myself a cup of tea.
Okay, so having watched that, I think it's clearer a bit what consent means. Some people find that video funny, other people find it quite disturbing. I think it's quite clear though in how we address and how we think about consent. So back to our presentation. Let me just bring it up on the screen here. Right, okay. So we've discussed consent, we watched the video, and the other thing that we wanted to discuss is this concept of abuse of power, right? So sometimes people feel unable to refuse advances from others because of a power imbalance. So that could be because someone's in a position of power, say they're your boss, say your teacher, professor, whatever, or perhaps they're older. So maybe someone who's, I don't know, 16, 17 might not be able to, or might not feel that they're able to say no to someone who's, say, 30 years old. Okay, there's an imbalance of power there. So that will mean that they're not so able to, or don't feel comfortable saying no. They feel obligated to say yes. It could be that there's a big size difference, that they're afraid that they'll be attacked, therefore they consent, and they feel that they are vulnerable because of that. It could be their mental capacity has been affected. So that could be either because they're drunk, they have taken drugs, or even with people with special needs, someone who's caring after them and they have a decreased ability to make decisions. They might agree to things which they don't fully understand. And remember, understanding is very key in giving consent. The other thing is that people might have a mental state or other circumstances which may make them vulnerable to advance from other people. So that could be someone who's depressed or who has bipolar and they're in a manic state and they would take decisions they wouldn't have taken if they weren't in that frame of mind. So what can you do about that? So you can empower yourself. So never do something you're not comfortable with. You should not feel under any obligation to. Feel that it's okay to say no. And if if you're not heard the first time, if someone keeps pushing, just say it louder. Make it very clear that you're not interested or you're not going to do something. Just be very clear. Don't feel embarrassed about it. Don't feel under any obligation to anyone. Okay, it's not okay for you to be pressured. They're the ones who are in the wrong for pressurizing you into doing something that you don't want to do. They shouldn't be doing that. Consent has to be uncoerced. You need to remember that as well, and you need to identify when you are being pushed into doing something that you don't want to do. You're under no obligation to do anything with anyone. As the video says, even if you told them earlier and they were under pretenses, if you suddenly change your mind, even if it's in the middle of sex and you suddenly think, you know what, this isn't right for me, I'm not comfortable doing this, you can stop. Could be that you decided to try something different in the bedroom, which normally you wouldn't do. You thought you'd try it. You decided actually don't quite want to do this. You can just say, you know what, actually I've changed my mind. Don't feel guilty about it. Don't feel that you've led people on. You did want to do something at the time. Now you've changed your mind, and that's totally okay. And you should be able to express that. Beware of manipulative behavior. So people lying, being deceitful, all of that can happen. Pressurizing you into doing things you don't want to do, saying that you're not interested in them, that you don't love them, and all sorts of manipulative behaviors can happen. So just bear in mind that that can happen, and to identify and recognize that it's okay to say no. So you should respect yourself and respect others, as we said. Treat others as you would like them to treat you. Or if you think that actually I would quite like this, think about how it might feel for you if your sister, brother, daughter, son, whoever was treated in that manner. Would you like other people to treat them that way? Really think about that and reflect on how it would make other people feel. Respect yourself enough to say no, as we've mentioned, and also think of the consequences. So if you have sex, there's always consequences to that. So potentially a pregnancy, an infection, or if you're doing something which you shouldn't be doing and it's illegal, prison. But of course, that's not really the main reason not to do something to someone else. You need to think about the impact on that other person. What might be a bit of five minutes of fun for you could end up being trauma for someone for the rest of their lives. So try not to do that. And while it's difficult for a presentation to get along the message that people shouldn't be doing bad things and illegal things, obviously you shouldn't be doing those, and it's never justified. It's important to sometimes stop and actually think about it, because I think sometimes part of the reason why people do what they do is because they haven't actually really thought it through. Try not to manipulate people. Don't lie to them. Don't make false accusations about them after sex. And if you do happen to take pictures or videos, don't share them. It is illegal. Even if it isn't illegal, it's unethical to do so. So, okay, so we've decided that, we've got consent, we're both happy, nothing's been coerced, no one's been manipulated into anything, no one's been lied to, everything's going, sweet as pie, and we decide to have sex. So what can we catch from sex? Lots of different things. Commonest infections, warts. These are treated with creams, freezing them off, burning them off. You can even have vaccinations which prevent them, like the HPV vaccination. Chlamydia and gonorrhea. Now, these are bacterial infections. They're treated with antibiotics, but they can cause some serious conditions like infertility, particularly in women, joint infections, testicular swelling and infections. Syphilis, it's making a comeback at the moment in Europe. This can be potentially a very serious disease. It can cause brain damage and dementia. It's usually treated with antibiotic injections, and there's a long process of monitoring to make sure that it has been treated. It's quite difficult to treat infection. Hepatitis B and C. Hep B can be vaccinated against. That will give you some protection, but Hep C, unfortunately, there's no vaccination for that. Both of them can potentially cause liver failure and or cancer. You can use pills, for example, with or treatments rather with hepatitis C, for example, to decrease the chance that you're going to end up with a chronic infection from it and that you'll clear it, but there's no 100% guarantee. There's no 100% treatment. Even vaccination is not 100%. You'd have to check your antibody levels, and even then you can never say, as with anything, that something is 100% in medicine. Herpes, there's different types of herpes, which you might have heard of. Genital herpes, which is the one we're referring to here, tends to be painful ulcers in the genital area. And while some people might not get it again or that often, usually it's for life. So once you're infected, it sort of sticks with you. You can have creams and pills which will help reduce the pain, reduce the duration of each time you get it. You can take them as prevention as well, but occasionally there's some people who really suffer with it. They keep having recurrent breakouts of these painful ulcers on their genitals, and it's not pleasant. So if you think you might have that, definitely get checked out and see your doctor. And as we've mentioned, HIV, of course, potentially very dangerous if it goes untreated. It can and does, as we've seen previously in the slides, kill people. But luckily, with modern therapy, which you have to stick to every day of the rest of your life, we can treat that very, very effectively. So understanding infections and the infection tree and how to break it. So here we've got a person with no infection in blue, and here we have infected people with red. Now, this could be any infection, could be chlamydia, for example. So here we have someone with chlamydia. They've had sex. This person's now also caught chlamydia, and they have sex with another 3 people, but they've used condoms, so the infection hasn't been spread. But they have sex with this person. So this person's only had sex with 2 people, but they've already started this chain of infection with chlamydia. This person's had sex with some more people, and they keep passing it on until it reaches this person, who decides to go and get tested. They get tested, they get treated, and therefore they break the chain of transmission. However, this chain of transmission reaches all the way here, where it can infect an infected person. The green lines here indicate condoms, so we stop it from being passed on. And again, we can see a similar chain here where we've got a chain of transmission, condom use here so it isn't spread, testing happens here so it stops being spread on, and so on and so forth. So test and treat can happen with some infections like chlamydia and gonorrhea, but it wouldn't happen with something like HIV unless that person has an undetectable viral load, in which case it will be very difficult for them to pass this on, right? So that's where treating people with HIV until their viral load is undetectable and steadily undetectable for a significant period of time, that will help prevent transmitting the virus. Here we say condom or other. We're going to go into that in a bit as to what that other could be. So how to prevent infections. Picture of a condom there, obvious. But it really starts with making good decisions. So that means that your judgment isn't impaired by alcohol and drugs. You just need to be aware if you're going to drink a lot, it could affect your judgment, and you could make silly decisions, which you may later come to regret. Having said that, that's no excuse for other people taking advantage of you. So making good decisions, again, also applies to people who think that, you know what, this person who is totally drunk, it's okay for me to have sex with them, when clearly they can't make a decision to have sex with you. So don't do that, right? Also be aware of peer pressure. So a lot of people might be putting pressure on you to have sex, like your friends, for example, say, oh, come on, you should have sex, etc. Just ignore that. Don't let people put pressure on you to do things that you don't want to do. That includes your partner. If you don't want to do something, just say no. If, for example, you are in a situation where you want to have sex, but hey ho, you're out of condoms, what can you do? Well, there's loads of different things which you can do which aren't sex, like, for example, massage, kissing, whatever. There's lots of different things which you can do which aren't sex. Wait for the next day, go grab some condoms, and then, Bob's your uncle, you can do what you like. So remember, you can postpone things for a later date if you want to. Condoms, obvious, but even condoms aren't 100%, particularly with some infections like warts and herpes, etc. Now, the other thing which we mentioned, which would prevent us passing on infections, are things like vaccinations. So if this was, say, hepatitis B, if these people are vaccinated, it might prevent the spread of that. And if we go back here to something called pre-exposure prophylaxis, pre-exposure prophylaxis applies to HIV specifically. It's a daily tablet which people can take where if they have sex with someone who does have HIV, it dramatically decreases the chances that they could catch an infection from them. So that applies to specific people. I'm not going to go into details, but if you do have questions about that, then you could ask your physician and get more advice about that. However, it's important to remember that this only applies for HIV. Now, PEP stands for post-exposure prophylaxis. So say you are having sex with someone and they have HIV and you don't know whether their viral load is controlled or not, you're not sure, condom breaks, and you decide that you've become exposed to HIV and you're at risk of catching it. You can take something called post-exposure prophylaxis. That's when you go to a clinic, you get pills and you take them for approximately a month, and that decreases your chances of catching HIV once you've been exposed to it. So this happens after sex. But like the morning after pill, which isn't really the morning after, the sooner you start the medication, the better. So if you started within a few hours of you having sex, then one would expect it to work a lot better than if you start it 2 days after you've had sex, where it's not going to work as effectively. So the sooner you get your treatment, the better. So the other thing we need to discuss is when, what, and how to test. So when should someone go for sexual health checkup? In between partners is a good idea. You finish one relationship, before you start your next one, you might think about going to get checked out. Once a year, if maybe you have one or two partners or it's a relatively new relationship. If someone informs you that they've got an infection, you might receive a phone call saying, hey, I've just been diagnosed with whatever. At that point, you would want to go and get checked. Or if you have symptoms like, for example, discharge or itchiness or burning, that sort of thing, or a rash, that's when you might want to decide to go and get checked out. I would say max every 3 months, and we're going to go into the reasons why for that. And this is variable depending on what type of test you use and what you're testing for. But essentially, for a test to become positive, you can't really go just the next day. So you have to wait approximately at least 2 weeks for chlamydia and gonorrhea test to come back as positive, 1 to 2 months for HIV test to come back as positive, and up to 3 or more months for hepatitis B or C test to come back as positive if you have it. So what should you test? Depends on the part of the body that you're using. If you're using your mouth, you need to test your throat, have a throat swab. If you're testing your lady bits, that depending on whether you've got symptoms or not, that could be a urine test or a swab. Penis, again, depends on whether you've got symptoms or not. And backside, that might need a swab as well. So we've got blood tests, we've got urine tests, and we've got swabs. And you'll have that conversation with your doctor or specially trained nurse as to what needs testing and how you'll test it. So how to access a doctor or testing, particularly here in Cyprus. So when you go to see your doctor, they're going to want to ask you several questions. And the reason they ask those questions is because they want to know what body part they're going to test and how exactly they're going to test it. And it really does vary whether you have symptoms or not. For example, if you don't have any symptoms and you've just decided to go for a checkup, they might ask you to do a urine sample. But if you do have symptoms, like for example, discharge, they might want to take a swab. So that's why they're going to ask you about symptoms, what parts of your body you're using for sex, and they'll then be able to judge what kind of test to offer you. So on the Cyprus Health System, the ESC, it does actually allow a sexual health testing, but if you do have those tests, just bear in mind that the test will remain visible on your record, as will the treatments for it. So I think there could be a way for you to hide them, but I'm not exactly sure how it works from the patient side. Just bear in mind that it's possible that those tests, if it's positive, might be accessed by other health professionals who might not want to see that. The good news is that if you're an EU student, you can register for the health system via something called an S1 form. And you can go here. So if you're watching this on the recording, you can just pause the screen now and type this into your address, or you can Google Munich Medical Center, and we've actually got information on how to do that. So I'll just show you what that website looks like now. Just bear with me. Great. So on this website, it will explain exactly who is entitled, how you can obtain this S1 form. First, you need to pick up your ARC, which is the yellow slip. It's usually a number which begins with 5 or 05. You then have to apply for your medical card, and that will allow you to enroll with the health system. So you can all find this information from the Munich Medical Center website, and you can register with either a GP here at the center, or if you prefer not to register with one of us, you can register with other practices as well. So let's go back to our presentation. Now, unfortunately, not all students are entitled to do that. If you're non-EU, we have tried to get the cost of you being tested down. So for students only, and for students who don't have any symptoms, if you do have symptoms, remember you should see a doctor. For students who don't have symptoms, there is reduced price testing for hepatitis B, C, HIV, syphilis, chlamydia, and gonorrhea. And you can get that done here at the medical center. It's, I believe, €70, but you would have to just call the lab and check that that's the case, and they'll allow you to get those tests done. We wouldn't see those results. So if something is positive or you want to discuss something, of course, you can come to one of the doctors here and discuss it with them. If you don't want to come here, there are other specialists, of course, who you can see. So you can go and see a gynecologist or a urologist or a dermatologist or any other doctor, really, who you choose. Just bear in mind that if you're having your pap smear with the gynecologist, they don't do sexual health screening as standard. So you would have to specifically request that you want sexual health screening. In terms of confidentiality, it does apply. We wouldn't tell anyone unless you specifically want us to. But it does depend on whether people are at risk. If someone tells us, for example, that they have hepatitis or HIV and they're actively going out to try and infect people, we may have to breach confidentiality in the interest of public health and in the interest of preventing harm coming to others. So just bear that in mind. I hope that we'll never come into that situation. So far, it hasn't happened in my career. But that's something that you need to be aware of in terms of confidentiality. There are limits to confidentiality with your doctor. And the other thing is contact tracing. So you may want us to share information, perhaps not necessarily say that it was you, but you might want to ask us, and not all doctors are going to be comfortable doing this, but I certainly am, in informing other people that they have come into contact with, say, syphilis or chlamydia. And we won't necessarily mention your name, but we will say, if you want us to and you give us the details, inform someone that they have come into contact with someone who's got chlamydia and therefore they should get tested. So in summary, approaching Christmas, we have to take consent seriously. It is an important issue. It's definitely been in the media recently with Me Too and with other initiatives. You have a right to say no. You shouldn't be pressured into saying anything. We can break the transmission chain and the infection tree by testing regularly, using condoms, using other methods, vaccinations, etc., to prevent spread of infections. Regular condom use is the best way to do this. If you're not yet registered for the health system, but you're entitled to it, so you're a Cyprus citizen or you are an EU citizen who is studying in Cyprus, you can try and register on the system, and that will entitle you not just to sexual health screening, but to a whole host of other services provided by the health system. And that's the end of our presentation. Thank you.